The Prime Minister and the Victorian Premier have held talks overnight after the deadliest day in the state's coronavirus crisis. 14 people died and 723 new cases were recorded yesterday. Stricter measures are now being introduced in regional areas, with masks to be worn across the state from Sunday night and visits to other households banned.
But this is a national story. North of the border, 3 more venues linked to COVID clusters in Sydney have been closed. The New South Wales government has given an exemption for 400 people to gather at a mosque in the city's west to celebrate Eid. And at Sydney's airport, people are now rushing to cross the border into Queensland before they are locked out. We'll go to Sydney in just a moment. But first, Steph Ferry is outside St Basil's home in Melbourne and Lexi Hamilton-Smith is outside Logan Hospital for us this morning. Steph, let's go to you first. The latest situation in Melbourne is not good as we wake up today on the back of those very dismal numbers yesterday.
Yes, they aren't great, Mads. Good morning. And as we've just heard there, the Prime Minister, Scott Morrison, and the Premier, Daniel Andrews, here in Victoria, have had a meeting to discuss this escalating coronavirus crisis here, with the numbers just simply not showing any signs of going down at this stage. And the Premier has always said that we are halfway through this 6-week lockdown in Melbourne and Mitchell Shire. And at this stage, he still has no idea what the situation is going to be 3 weeks away from now, and any decisions about extending that lockdown will be driven by the data. Scott Morrison has said that he can't rule out further restrictions here. And I'm at St Basil's Home for the Aged, which is in Fawkner in Melbourne's north. This is one of the worst affected aged care homes. Obviously, we're seeing a lot in the aged care sector here. The numbers here have jumped up to 111. That's an increase of 22 in the space of a day. But while this is the worst, obviously across the board in private sector aged care homes, we're seeing around 900 infections now, and sadly 57 people have died. And as we mentioned earlier, after a couple of days where it looked positive and things were looking like the numbers were going down, we had a really depressing day yesterday with 723 new cases. That's a record number of new cases so far, and 14 deaths. Now, that included 3 men and 3 women aged in their 70s, 3 men and 2 women in their 80s, and 2 men in their 90s. And then later on in the day, a man in his 50s from Portland in southwest Victoria also lost his life to coronavirus, although that death will be included in today's tally.
And Steph, growing numbers in regional Victoria as well. We will cross to regional Victoria to get an update a little bit later on in the hour. We'll leave it there. Thank you, Lexi. Let's go to you in Logan, just southeast of Brisbane. This is now at the centre of one of the concerns, the growing concerns about a potential cluster, we should say at this stage.
It certainly is. It's all on the back of 2 women that allegedly lied on their border declarations about visiting a Melbourne hotspot. They flew in through Sydney and then basically evaded quarantine by apparently lying about where they had been. Now, what we've got behind me here is 2 fever clinics. They've had thousands of people lining up in the last 2 days, and they're expecting thousands more today. It just shows, Mads, how anxious people are here. They're getting tested not because they're sick, because they are worried about the fact that these women roamed around this area and Ipswich and South Brisbane for 8 days, potentially, not knowing they were sick, but potentially maybe infecting others. So we should know those results when the Premier speaks in an hour or two's time, and that will really tell about these infections, because at the moment we've only got 11 active cases, 5 people in hospital. But if these thousands of tests start coming back and we start getting rolling numbers, that is really a great concern for Queensland, because as you know, we had managed that first wave extremely well. So there's a lot of anger here in the community, and even, as you know, the police commissioner using words like deceitful and criminal behaviour about the way these women have gone about this.
Very strong words, and also it appeared yesterday that at least one of the women wasn't cooperating with police initially, but she now is.
Well, that's right. She wasn't cooperating about her whereabouts, and that led to further ABC inquiries, and we can now reveal that the police are actually looking at whether a criminal gang helped coax them into how to evade quarantine. And they're also looking at whether these women were involved in a luxury goods theft program. They were also encouraged to destroy mobile phones to get rid of evidence. And obviously they've also been charged with fraud at this point. 2 of them are under police guard in hospital. 3 of them do have coronavirus. And fraud, Mads, 5 years jail time in Queensland if convicted. So, you know, the police are not mucking around here. They're trying to get this message out that we have an honesty system, and if you allegedly lie, they will throw the book at you.
Lexi, thank you very much, and we'll of course carry the news conference from the Queensland Premier on the ABC News channel. Steph, thanks for your report from Melbourne this morning. In other news, a senior Australian Border Force officer who allowed passengers to disembark from the Ruby Princess cruise ship in March mistook negative flu tests for the results of coronavirus screening. The ABC revealed last night that Border Force Command only realised the mistake more than 30 hours after passengers had left the vessel. This challenges earlier claims by Border Force Commissioner Michael Outram that New South Wales Health was solely responsible for allowing passengers to leave the ship. In a statement, Border Force says it strongly refutes the claim and that it does not have the authority to make biosecurity decisions. But the opposition says the government needs to apologise.
This is a Prime Minister who's got a trophy on his desk that says, "I stopped the boats." Well, Scott Morrison and Peter Dutton failed to stop the one boat that mattered, the Ruby Princess.
Donald Trump has suggested November's US election should be delayed, claiming it's likely to be inaccurate and fraudulent because of a large number of postal votes. The date of the election is enshrined in the US Constitution and could only be changed by Congress. The President has repeatedly claimed without evidence that mail-in voting would be susceptible to fraud and says the result must be known on election night.
And they say the projected winner or the winner of the election. I don't want to see that take place in a week after November 3rd or a month or, frankly, with litigation and everything else that can happen, years, or you never even know who won the election.
Let's take you now to the Gallipoli Mosque in Sydney's west because it's been granted an exemption allowing it to host larger groups of people for Eid prayers this morning. Our reporter Lily Mayers is there. Lily, this is because this is one of the most important days on the Muslim calendar. What's happening?
Good morning, Mads. That's right. Hundreds of Muslim worshippers are expected to come here to the Gallipoli Mosque for the festival today. New South Wales Health have granted the mosque a one-off exemption from the current restrictions that limit places of worship to 100 people maximum. That exemption is going to allow up to 400 people to come to the mosque today, separated in 100 lot groups, all for Eid al-Adha, which is a festival usually which attracts thousands of people here to the mosque.
Now, that special government exemption was granted because they're going to put in place some special measures to ensure safety at this time. What are they doing?
That's right. The mosque has had to prove they can safely have everyone here. So there are temperature checks, sign-in sheets, masks are mandatory. Everyone who comes has to bring their own mat for prayers. There is no shaking hands and no hugging, obviously, and all attendees will be separated into 4 zones across the mosque's 2 levels, as well as an adjoining hall and a car park also.
And just give us the latest on what else is happening in Sydney this morning on the COVID front.
There are 3 more venues across Sydney that have had to temporarily close because of visits from infectious people. One is Harpoon and Hotel Harry in Surrey Hills, which an infected person visited on Sunday night. The Tan Viet restaurant in Cabramatta was also potentially infected around lunchtime last Thursday. And Matinee Coffee in Marrickville has had an infected person visit on Sunday and Monday. The cafe has now been cleared after being deep cleaned to reopen, and anyone who visited any of those venues at similar times has been urged to keep on the lookout for any symptoms developing.
Lily, thank you very much for that. And questions, Ben, this morning, or suggestions from Woolworths in particular, that people wear masks now in their stores, not just in Victoria, but in New South Wales.
It's coming. It's going to spread. I'd say, look, unless you're in sort of Tasmania or Western Australia, perhaps even South Australia, but certainly New South Wales and Queensland, I'd be starting to work out where you might be getting your masks from, because there's every chance that you're going to need them. I know when the situation in regional Victoria was announced yesterday, I've got relatives in Mildura. There was just a rush on Spotlight, and it's going to take people time to get hold of what they need. So don't be left in that situation. Okay, let's actually get a bit more on the situation in southwest Victoria. Of course, it's where restrictions have come into force amid that rising number of COVID-19 cases. Sarah Jane Bell is in Colac for us this morning. Sarah Jane, good morning to you. You're in Colac because this is a place where the community have actually been calling for this for quite a while.
Good morning. That's absolutely right. The Colac community have been calling for further restrictions for 2 weeks now, since the outbreak began here at the largest employer. Now, this will be one of the 6 local government areas that are subject to these new conditions that the Premier announced yesterday. So from midnight last night, residents can no longer have visitors to their homes, but pubs and restaurants and gyms will remain open. Now, the reason those shires are subject to these new conditions is because 159 of the 255 active COVID cases in regional Victoria are in those shires in southwest Victoria. Now, these shires are quite widespread geographically, but their workforces are very intricately linked with Melbourne, Geelong itself, and even Ballarat. So a lot of the mayors in those shires have welcomed these new measures, given they feel the virus is right on their doorstep. Here in Colac, we've actually been seeing people wearing masks for 2 weeks now. So obviously from midnight on Sunday, regional Victorians will have to wear a mask. That will be mandatory. But this community has been on the front foot since the outbreak at the Australian Lamb Company, the abattoir here. So there's currently 64 cases linked to that abattoir of the 76 that have been announced in this town, up from 0 2 weeks ago. And so the community here have been implementing their own kind of lockdown, with a number of businesses closed and schools are closed for certain periods as well. And while they have welcomed these new restrictions, they say a lot of them have already been in place, and it'll just be the stragglers that it's picking up now. But they are actually wanting further measures and further input from the Premier. They want more direction for the public schools here, which they say should have returned to remote learning. It's a town of about 11,000 people, so with a high percentage exposed at both the largest employer and the largest school also linked. They say there should have been further measures implemented already, and are still calling for a bit more aid.
Now, I understand that the case numbers at the meatworks are still going up, and yet they're talking about reopening.
That's right. So the Australian Lamb Company is looking at a staggered reopening from as soon as Monday. Now, that would be subject to approval from the Department of Health. However, those case numbers, as you say, are still going up. The workers at the Australian Lamb Company were retested earlier this week. 550 of them actually were retested, just given those close working conditions. Now, if the company is to reopen and the abattoir and meatworks is to reopen on Monday, as I said, it would be staggered. The production would be much, much lower as well, and new social distancing measures would come into effect. On top of that, workers would have to have proof that they have tested negative to the virus. But until we see that happening, we will continue to have ADF. The Defence Force have been on the ground here, about 20 people here that have been helping with local authorities to door knock and ensure that those who need to be in isolation, those that either have the virus or who need to be in quarantine or are linked to someone who has the virus as well, to make sure they are at home and following those conditions. As I said, given it's spread to the largest employer and the largest school, it's a community that's been very much on high alert to try and ensure that it doesn't spread any further.
Thanks very much, Sarah Jane Bell, on a chilly-looking morning in Colac in southwest Victoria. Mads.
That is the unfolding situation in regional Victoria. Let's take you back to Melbourne now, where what can only be described as a tragedy has already unfolded and is continuing to unfold in the aged care sector. Let's just take a little look at where we are at in terms of that particular sector. So we currently have 877 active cases, nearly 900 cases across aged care facilities. 10 of yesterday's 14 deaths were from aged care. 111 cases are linked to St Basil's in Fawkner, and 99 cases are linked to Estia Aged Care in Ardea. There's just a little map that we've got that can sort of show you the extent of the aged care crisis, and this is where it is. You can see spread right across the city and huge numbers there. Plenty of questions to ask. Let's see if we can get some answers. We can bring in Pat Sparrow, the CEO of Aged and Community Services Australia, which represents care homes, and she joins us now. Pat, thank you for joining us.
Thank you for having me.
Why was the aged care sector not ready for this?
I think the aged care sector was ready, as we saw in the first wave. I think what's happened this time with the amount of community transmission and the scale of what we're now seeing has contributed significantly, or is the main cause really for why we have so many cases of coronavirus now in aged care. We have to cut the community transmission to be able to cut it getting into aged care.
Well, look, that is undoubtedly a concern, the community transmission, but really that's not an answer. We saw what happened at Newmarch House. We know that in the UK, a third of all deaths there were in aged care settings. Now, community transmission is one thing. We know so well now there was not adequate PPE. There were staff working across multiple sites. There were cleaners working across multiple sites. None of this was done. Why not?
So PPE was an issue and is still remains an issue, and I think we've seen a worldwide shortage of PPE, and I think we're trying to get on top of that now. When I say we, that's a collective effort across state and federal governments, and we're making sure that there is the PPE there. I think one of the key things that we should be doing in this, and it's a warning for other states really as well, is that we actually should be making sure that we transfer those people who test positive, those first cases in residential aged care that test positive, should be transferred to hospital. They need to be transferred to hospital to get the support that they need, but also so that we as providers can actually stop the spread within the facility and make sure that we don't have it going further. Aged care providers are not hospitals. We're not staffed like hospitals. We're not funded like hospitals. We have to make sure, one of the things that we can do now in Victoria still, but also in other states, is to make sure that we do that to give us a fighting chance of stopping more spread in these homes.
Undoubtedly many lessons to learn from the Victorian experience for other states as well. One of them is going to be about communication. We had John Atsarakis on a little bit earlier on the program. His mother Fatina died in St Basil's, one of the terrible many numbers of deaths from that particular facility. The communication to him was disgraceful. There was essentially no communication, and we have heard these stories right across the sector. Now, that is something that aged care providers should be able to do, and it's inexcusable really, isn't it?
It is inexcusable. I think what's happened is that as the system's under stress, so in a home they're trying to staff, they're trying to make sure everything's happening, the Commonwealth government's in, the state government's in, but that's not an excuse. Please don't take it that way. But I'm saying I think it is a little bit confusing and chaotic on the ground when an outbreak happens. It's not acceptable that families are not getting information, and it's something that we're really focused on trying to get everybody involved to make sure that families are a priority. And can I please just pass on our sincere condolences, and our thoughts are with everybody who's lost a loved family member and with those who are waiting to hear how a family member is doing. It is something that all of us, state, federal and Commonwealth governments and providers, must do better.
And there is no doubt that the people actually working in those facilities are doing the best that they can within the circumstances. There are so many issues here. But having seen what has happened in Victoria, what comfort can you give to Australians? What can you say to Australians in other parts of the country this morning to give them a reason not to pull their elderly relatives out of care homes today?
Look, I think what I can say is aged care providers deliver aged care. And so if you're in that circumstance, and most people around the country will be, where aged care is being delivered. But again, I would say we're not hospitals, and this is where it's absolutely critical that Commonwealth and state and providers are working together, and that we have a plan to make sure that those individual people are going to get the care and support that they need. That includes transferring them to hospital when they're diagnosed as positive. I think if that happens and care homes homes are able to continue to be care homes, there's no need to be overly concerned. But this is a warning, and we have to do this in other states. We have to be ready. We have to coordinate. We have to make sure that we've got the right policies in place.
And OK, let's hope that that's happening. Pat Sparrow, we'll have to leave it there. Thank you very much for speaking to us this morning.
Thank you for your time this morning.